Hi everyone, my name is Dr. Allison Waring Scott. I am here to talk to you about the newest clinic in the area, Carrollton Equine. So Carrollton Equine is located in Carrollton, Ohio, and we are a full-service equine facility. What I'm going to do is tell you a little bit about what Carrollton Equine does and what services we provide, and then I will give you a little bit of background about me so you know my history, and then we'll move on to some frequently asked questions, and then if you guys in the audience have any questions, you can go ahead and ask and I will see it in the chat. So Carrollton Equine, as I said, we're full service practice. If you are within our call radius, we service about 30 minutes from Carrollton Animal Hospital, which is our sister organization. If you're within a 30-minute drive, which is roughly about the population of Carroll County, then we can provide all services for you, including routine work and emergencies. If you are located outside of Carroll County, sorry, my cat's going to make an appearance here. If you're located outside of Carroll County, you are welcome to use our services as a haul-in. We do have access to Shenanigan Stables, which is our other sister company that will allow haul-in facility work such as lameness and their beautiful indoor arena, as well as kind of a more controlled area to do procedures such as joint injections and dentals. We are in the process of making an actual veterinary barn at Shenanigan Stables, and that will have a set of stocks, it'll have stalls, it'll have a lab. It will be a very nice temperature-controlled, heated barn where people can come and get all of their vet needs met. If you live outside of Carroll County, or if you're further away than 30 minutes from Carrollton, we can offer some services, such as elective services such as chiropractic, acupuncture, lameness, and some dentals. Just know that we will not provide emergency coverage that far out, so you will still be expected to have a relationship with another vet, as that will technically be outside of our emergency area of coverage. You are still at all times welcome to haul in for emergencies, so it doesn't matter where you live. If you have access to a trailer, then you can come and we will see you anytime, day or night, for emergencies. So what type of services do we actually offer? Vaccines, deworming, health certificates, Coggins, all of your normal day-to-day, as well as some of the more advanced equine services such as full-service lameness exams, pre-purchase exams that are very in-depth, and modern dentistry. Some of my personal interests include dentistry, so we have all the fun toys. We have intraoral and extraoral radiograph capability for dentistry. We have an intraoral camera that we can use to take images, and we have some of the top of the line out there motorized dental tools that use water cooling to make a more comfortable experience for your horse. We also offer some more complementary therapies such as chiropractic and acupuncture. Both Dr. Kelleher, the practice owner, and myself are certified in chiropractic and acupuncture, so that is something that we do quite a bit of, and we see a lot of success. I really enjoy doing that. And we also have some other great services such as laser therapy. We do have a cold laser, which I really like for wounds and lacerations. I get really good results when I sew up a laceration and I use the laser. We also have a shockwave machine, which is great for any sort of kind of a lot of musculoskeletal injuries such as tendon injuries, some small bony fractures, even just areas of muscle soreness and arthritis and pain. Shockwave can be really effective, but it's definitely great at kind of supercharging an area to get to heal. My favorite area to use it is in tendon and ligament injuries. We definitely see a reduction in swelling and improvement in comfort with using the shockwave machine. We do also have a gastroscope, so if you think your horse might have gastric ulcers, the only way to tell if your horse actually has gastric ulcers is to do a gastroscope. And that is something that the we are currently doing only on the farm, so you have to come to Shenanigan Stables to get a gastroscope performed. If you have a barn with multiple horses, we might be able to schedule a gastroscope day where we do an entire barn, but as of right now, all single horse or few horse gastroscopes will be taking place at the farm. And if that's something you're interested in, then we can definitely give you all of the information with that, because there is some special prep that you have to do in terms of holding them off of feed for a certain amount of time. Basically, any sort of ailment your horse has, we can do it. Besides more involved surgical procedures, we can do minor field surgeries such as castrations and hernia repairs. In fact, just the other week we did a few castrations in the indoor arena at Shenanigan Stables, and it went really, really well. It's a nice place to have a nice controlled environment with good, clean, dry footing for you to be able to lay the horse down. And then we do offer stalls for overnight, so if you need to drop your patient off the day before or pick up the next day, I like with castrations for them to stay at least overnight if they are going to be trailering, just so I can lay eyes on them before they leave and make sure we don't have any complications. And this time of year, doing castrations out in the cold, in the mud, in the bad footing really isn't an option. So if you have a colt that you want to be gelded, give us a call, and if you can get them here, it's a great time of year to do it in a nice kind of clean, dry, controlled area. So that's basically a lot of our services, full service, emergencies in Carroll County. Otherwise, we do elective stuff outside the county. So a little bit about me. So as I said, I really enjoy dentistry. That is one thing. So I'm originally from New York. I went to Ithaca College for undergraduate, got my degree in biochemistry, and then I went abroad and did my veterinary degree at University College Dublin in Ireland. So I lived in Ireland for 4 years learning about all the veterinary stuff I could need. The reason I chose Ireland is because I knew since when I applied to vet school that I really wanted to work on horses, and that's all I really wanted to do. And Ireland has a great history with horses, and they just have a really great horsemanship there that I wanted to learn. So that's what we did. That's what I did. Going back a little bit, speaking of horsemanship, I am a proud previous pony clubber. I did that for many years in high school. I am a proud previous 4-H member. I did 4-H for many, many years. I especially loved horse bowl and all the really nerdy quiz type things. My background equestrian-wise is English in primarily dressage with some eventing with the pony club. I grew up with Morgans. My parents had a small Morgan breeding farm, so I always had horses in my backyard. Horses have just been a second language to me, so that's just why I wanted to go into horses when I knew I wanted to be a vet. So I do have a lot of experience working on horses from all backgrounds: race horses, barrel horses, hunter jumpers. But my personal riding experience is with Morgans and a lot of dressage with some eventing in there as well. So I went to vet school in Ireland, then I did an equine internship at the University of Illinois Veterinary Teaching Hospital. It was an equine exclusive internship where I rotated between medicine, surgery, and ambulatory, so I was able to get experience at the referral level and the primary care level. I absolutely loved my internship. I got to teach vet students, which I'm also very passionate about, is teaching. So after my internship, I got a job back in New York. I joined an equine exclusive practice in the Ithaca area that specialized in sports medicine but was a full service practice as well. So I lived in New York and practiced with them for 6 years before moving to Ohio. And in Ohio, I have been helping to start up Carrollton Equine, and I've been involved with it for a while in the background, getting all the planning and organization and ordering of equipment and everything for quite some time. So I'm pretty excited to get this up and running, and we've been open since October 1st. That was our kind of grand opening, and we've been seeing all sorts of patients since then, and it's just been a lot of fun. So I'm really looking forward to spring and summer when people are going to be doing more competition and all of our regular spring work, so I can really get out there and finally meet a lot of you guys that are going to be our regular clients. So right now we're kind of making it through the winter, doing some routine stuff, some emergency stuff, but hopefully once show season starts to kick off, we'll see a lot more of you for your lameness and performance evaluations, and maybe I'll see a lot of you out there at the shows. So my professional interests include, I really enjoyed dentistry. I have always enjoyed doing equine dentistry. It's something I'm very passionate about. Back in New York, I would do literally hundreds of dentals per year, so I have quite a bit of experience with it. I have done advanced training with it, and it's something that if I could do it all day long, I probably would. So I really enjoy dentistry. That's kind of my little pet project that I'm very passionate about, and at some point I'll be doing a Facebook Live specifically about dentistry because I could talk about that for a very long time. I also really enjoy ophthalmology. I've always enjoyed eyes, and I have also done some advanced training in terms of eyes and different procedures and different treatments, and I'm very comfortable managing a lot of these cases in the field, and I've worked really closely with some great ophthalmologists in the past, which I will continue to do so. So I enjoy eyes, and then I also enjoy the acupuncture and chiropractic. That is something that I like. Horses don't really know the placebo effect, so it's really satisfying when you treat a horse and then the owner says they do so much better afterwards. So that's something that I really enjoy, and I think a lot of horses can benefit from that. And I also have a particular interest in old horse care. So geriatric horses have a special place in my heart, and I'm very passionate about their proper feeding and their proper management, and I just think they're the greatest thing. So I personally have a 33-year-old Morgan, who is my old pony that I used to ride when I was young, who is now very much retired. And then I have 2 miniature horses who are retired previous college horses, and they are in their late 20s themselves, so I have a little geriatric herd of my own. And then I have a 5-year-old Morgan who is the youngin' who doesn't really do much at this point in time. So those are my particular areas of interest, but I have experience with pretty much every area of equine. I have quite a bit of lameness experience. I really also am passionate about proper lameness and kind of ethical lameness, and used when it should be performance enhancing versus quality of life enhancing. And anything that we can't perform, we do have a good relationship with Equine Specialty up near Cleveland, so those folks are great. And if we ever have something that needs advanced diagnostics, such as a bone scan, we can definitely call them up and they're happy to take them. And then if we ever have any actual kind of serious emergencies, such as colic that needs surgery, then we have them right on our phones. We call them, we say, look, we're dealing with this, and they say, okay, send them on over. So it's really great that we have that good referral relationship with that practice, so we can still provide those services for things that are kind of beyond the scope of what we can do right here on the farm. So I think that covers kind of my interests and a little bit of my background and what the clinic is all about. So what I'm going to do is, we have a few questions that were submitted that are kind of some frequently asked questions, and just some stuff to go over for people that couldn't make it to the live stream tonight but just had questions that they'll watch on the recorded video later. So we did have a few people asking what type of services we provide, and as I said, we are a full-service equine clinic. The only things that we don't provide are some of the more advanced level surgeries that are at referral level, but basically anything that ails your horse, we can come out and take a look at it. We are an equine exclusive practice. I do not work on any other species besides equine. I don't work on cows, I don't work on cats or dogs. I have been equine only since the day I set foot in vet school, essentially. They are definitely my preferred area of expertise. And then what areas do we serve? As I said, we have We consider our routine clients, the clients that we can provide emergency services on farm, is the Carroll County. So if you're in a 30-minute radius, then we can come to your farm. We do have a fully equipped vet truck as well as the farm that we can use here. So we can do quite a few emergencies, anything from colics to down horses to lacerations. We've seen some pretty impressive lacerations recently, which have done really well with the laser. I've been very happy with them. So those, if you want a more exhaustive list of all the services that we offer, you can go onto our website where everything's pretty clearly laid out. But basically, if you can think of a horse veterinary need, we most likely do it. And another comment, which I didn't mention in the services, so with the veterinary barn that's going to be built at the Shenanigan Stables, there will be a lot more advanced reproductive work. So we are going to be having a mare barn where people can come and drop off their mares to be bred, and they can get checked every day while we're here. And we are hopefully going to be doing breeding with fresh cooled semen. We're going to offer breeding with frozen semen, and if we can get the correct equipment this year while still in breeding season, there's even talks of starting to do embryo transfer, which would be very exciting because that is quite a high level of reproductive services that you don't find in just kind of everyday vet clinics. So that is something that we'll be able to offer slightly more advanced services for, is the reproductive barn. And that is going to be part of the veterinary barn, which is currently under construction, but should hopefully be open soon by the time people start wanting to breed their mares. Okay, how do I make an appointment? So luckily in today's modern age, we have lots of different options. I believe there is a way to go on our website and make an appointment link on the website. But some of the easiest ways to do it is just give us a call. So you can call Carrollton Animal Hospital, which is where we are kind of based out of right now until the vet barn gets built, and they will send you to the right person. But we do have a line that is dedicated equine, and every day there will be a assistant that is on reception duty who will have that phone, and if you call or even text, it is a cell phone. We have had some people text to make appointments, and that's totally fine. Sometimes it's just easier to call because you can get all the information, but the number is 330-323-8654. And again, that should take you directly to the equine receptionist on call, and they will know how to schedule you, when they can schedule you, and they'll get all of your information to get you on the books. Let's see, I have a question about, if I have a question about my horse, can I speak directly to a veterinarian? So I always tell people that I don't ever feel like you're bothering us by calling and asking questions. If it's an emergency, then it will be transferred pretty much directly to me. Otherwise, the receptionist will take your question down and we will call you back. But depending on our schedule, we might be able to talk to you right at the time that you call, or it might be a call back. But yes, you will be able to speak with us directly for any questions or concerns. Especially when it comes to, I'm not sure if I need an appointment, my horse is doing this weird thing. I am always welcomed people to talk to me. I don't kind of tell people, I won't give you advice unless I just come out and see the horse. I do have to see the horse to give medical advice, but whether or not you actually need an appointment, I am more than happy to always kind of talk to anyone. And it also comes to if you think not sure if something is an emergency or if it can wait, by all means ask. I'd rather people ask and kind of have my phone busier than have people put it off and then end up having to have a more emergent situation later on in the day. Let's see, my horse is in an emergency. What do I do? So if you do have an emergency, first thing is don't panic. It's always very scary when it happens, and I will tell you, horses will fool you. Some things that look like they're going to die, they're going to be just fine. Very few things are true panic-worthy moments. Most things, we can get them fixed up and they'll be fine. So if you are experiencing an emergency, and by emergency, I'm talking about things that are causing immediate significant discomfort or pain, such as colic. Horse owners, worst nightmare, colic, but we all know about that. If you have a horse that's experiencing colic symptoms, please call at the earliest sign. It's a whole lot easier for us to talk to you about a treatment plan, whether that involves us coming out or not, when your horse is first starting to show signs versus calling at 1 o'clock in the morning because your horse has been colicking all day and hasn't gotten better. So especially with things like that, I would much rather talk to you, get a feel of what is going on at your barn, possibly give some advice of what to do before I get there, and then be kind of very much in the loop and knowing what's going on throughout the day. So if you do have an emergency, you can still call that reception number, the 330-323-8654, if it's during the day. If it's during the day, there will be someone there answering the phone. So and by day, I mean business hours, so from 8 to 5, Monday through Friday. If it's after 4 o'clock or before 8 o'clock, you should call the actual Carrollton Animal Hospital, the main line that sends you to the hospital, not the equine cell line, and that will forward you to the answering service. And the answering service is a group of people that will get your problem from you, you tell them what you want, and then they will forward the call on to us. So if you call the cell number, it should direct you to the right place to get to the answering service. Now, just because you call the emergency line doesn't mean that you immediately are going to get charged or have to have an emergency visit, especially once I get to the point where I get to know you guys and I get to know your horses more and we have a more kind of established relationship, the more comfortable I am kind of talking things through over the phone. And as I said, I would so much rather people call and talk rather than kind of put things off until they're much more serious much later. Okay, how do I prepare my horse for an appointment? Do you need any special paperwork? So it's for an appointment on the farm, the biggest thing to prepare for is to have your horse inside. I have definitely played the go catch the horse in the field game, and it is just not fun for anyone, so please have your horse inside when we get there. When we schedule, we don't always give exact times. We aren't going to always be like, we will be there at 2:15 p.m. just because the nature of the job is it's very hard to get a schedule down to an exact minute. If you have a more limited schedule and you know that you're only going to be available for a short period of time, or you can only take a half day off of work, or you have to drop the kids at the babysitter, I always recommend to try to get a morning appointment because the morning is a lot more predictable. So if you need an appointment at 8:30 and we have to be there at 8:30 because if we get there at 9:30 for your quick appointment, let's say Coggins vaccines, that you're not going to be able to do it. The morning is always more predictable because as the day goes on, things come up, add-ons are added, emergencies happen. And if you have any of those scheduling conflicts and if you're only available for a certain window, just definitely let us know so we can schedule around that. So in general, we try to be a little bit more vague around, like we will be there morning, midday, and then afternoon, and we'll just give you a call when we know we're finishing with the appointment. So you still get a heads up, we don't just show up, but having some flexibility in your schedule just makes it a lot easier. And I always tell people that it's because if we were dealing with their horse and what we thought was a simple problem ended up being more complicated and needed more diagnostics, they would want us to spend that time with them and not kind of rush through the appointment to try to make a certain timeline. So that same courtesy extends to people being understanding when we end up having to run behind, and especially with emergencies, being understanding if we can't get to you because an emergency is great because someday that horse with the emergency might be you, and we may have to cancel a whole days of appointments to come help your horse, which we'll happily do. So most people are pretty good about that. So I would just say, know your schedule, know your availability, let us know what that is so that we can work the best with you. Have your horse inside, ready to go. Um, don't try to schedule appointments during times that you know are going to be really busy, like feeding time, because horses can get really distracted and agitated during those times. If it's mud season like it is now, they don't have to be spotless. I don't expect everyone to get a bath, but especially if we're doing lameness work and we need to work on the legs and feel the legs and flex the legs and maybe put needles in the legs for nerve blocks, having a leg that's covered in mud makes that a little bit difficult. So just having a general brush down, making sure your horse isn't covered in mud, making sure that they're caught is really, if you start with that, we can do pretty much anything. There are some requirements for on-farm appointments in that if you want a dental performed on your farm, we will need some sort of access to shelter. It doesn't have to be fancy. It can just be a clean, dry run-in shed. If the weather is good enough, we can still do it there. All of our equipment is portable and all of it is on batteries, so we don't need access to power. But if you want us to be able to do things safely and quickly, having a clean, dry area out of the elements is the best. So even if I've worked on horses in garages, I've worked in horses in run-in sheds, I have worked on horses in the middle of the field in an emergency situation, but for some of the stuff it's just not safe or practical to do that. For coming onto the farm, we like you to just kind of be punctual, just because if you have a time blocked off on the farm, that's not something that we're doing other things. We will be sitting there waiting for you. If we know that we will be delayed because of something else that happened, we will let you know. But a similar thing, making sure that they don't get off the trailer covered in mud or really dirty or with their legs smeared in poultice, just kind of clean and dry. And if you're running into delays, which happens, we all know horses, sometimes they don't get on the trailer, sometimes there's a road closed, that is totally fine. Just give us a heads up so we know when to expect you. And as for paperwork, if you're a new client to us, it is useful. I think it just went offline. Okay, I think I went offline for a second, but now it is. I think we should be good. So it looks like we have a question. Do you have requirements to be an emergency client, such as do I need to do my dentals and vaccines with you? That's a really good question. So, okay, great. So for emergency coverage, right now we are a new practice. We are starting to get clients, and unfortunately sometimes the way that we get clients is through emergencies. And since we're so new to the area, there's been a lot of people that already did their spring vaccines or dentals over the summer. So right now we're not being incredibly strict with what clients we will serve for emergency purposes, because it hasn't been a full year, so we fully expect that lots of people have already had their routine work done by another clinic. But it may get to the point where if we get a full schedule and it gets to the point where we are busy enough that we're not taking new clients, then having emergency coverage is going to be reliant on you being what we consider a routine client. But as of right now, that's not something that we're enforcing, just because we haven't even been established long enough for people to really have developed a routine relationship with us, just because it's kind of a weird time of year where people don't do all their routine stuff in the winter or late fall when we started. It might get to the point where if we're busy enough, just know that if we're busy and we have multiple emergencies and we have multiple people calling, the people who we're going to have to give our priority to are the people that we already have relationships with. So if you have never seen us before and say this is 6 months down the road, a year down the road, and you call with an emergency and I'm already tied up at another emergency, I'm going to have to tell you to call your other vet. Or if I get 2 emergency calls at the same time, I'm going to have to give preference to the people who we have a relationship with. That's not something I foresee being a problem right now, but so as of now, anyone that's within our 30-minute call radius, you can call with an emergency and we will show up. Okay, what is all included in a lameness exam? That's a great question. So a lameness exam, first I want to say that when we talk about lameness, and a lot of people know this, but some people there's a little bit of a misconception. Lameness does not always have to be my horse is three-legged and limping and can barely walk. That is a degree of lameness, but that's a pretty serious degree of lameness. So when I talk about a lot of these lameness exams, especially for like performance horses, it's more of my horse is maybe just not catching that second barrel, or they're just a little stiff, or when they go over the jump they're landing with split leads, or they're just a little bit more resistant going into the canter than they usually are. Lameness can be really subtle, and it can be a low grade where the horse is still perfectly rideable and showable, but they just might be like stiff in a little area, might have a little bit of arthritis that if we got into a management plan they could perform even better. So sometimes I say lameness exam to people and it puts up big red lights like my horse isn't lame, they can, like I'm still showing them, I'm still doing things, and that it could be very, very true. But there are some kind of barns where they basically schedule a lameness exam for every horse that's showing every year, so we can lay eyes on them and see, okay, are they a little stiff behind? Are they a little bit bracing in the neck? Maybe we need to change their shoeing package because they might be a little bit footsore. So it's worth investigating some of these really more subtle issues. And for that, what we do is it starts with, well, actually I don't want to say starts, but we will watch them go on a lunge line. I really like having lameness exams if you don't have access to an indoor arena to come to the farm, because right now the footing this time of year, we have to watch them go in order to judge if they're lame or not. And lameness is all about symmetry and how they move, and if it's in a really muddy or slippery arena outside, then it's really very difficult to make a judgment based on that. So if you don't have access to an indoor arena or an outdoor arena with excellent drainage and footing in poor weather like this time of year, I really like lameness exams to haul in because it's such a better evaluation when we have a nice kind of clean, dry, even footing to evaluate them on. So we'll watch them go, watch them on the lunge, both directions, walk, trot, canter. If it's something that is a little bit more subtle, that maybe the rider, because some of these lamenesses just start with something that the rider feels. Like, I just feel like he's not engaging his left hind as much. So sometimes, depending on the horse and the situation, I might have someone actually ride the horse, so then we can see what they look like with a person on their back. So we'll watch them go on the lunge line, both directions, big circles, small circles. I watch them jog in hand. We have assistants with us that are trained of how to do lameness exams, so they'll usually do the lunging and the jogging for us, and you just get to hang out with me and sit and watch, and we get to talk about what's going on. And then we watch them jog in a straight line there and back, or kind of to the end of the arena and back. And then we do flexion tests. And flexion tests are our way of further isolating where we think an issue is going on. And this usually happens all after I've done kind of a thorough like physical exam, like laid my hands on them, felt their back, felt all their joints, felt their tendons. Put the hoof testers on the feet to see if they might be foot sore. But the flexion exams is our way of kind of further narrowing down where an area might be sore. I know there were some posts circulating on social media that pop up every once in a while that talk about how terrible flexion exams are and they can't be trusted, and that every horse is going to be lame to flexion exams. And I think a lot of that kind of resentment comes from pre-purchase exams where people have had horses that have flexed positive on pre-purchase and then the horse didn't sell for whatever reason. And I will say flexion exams are a valuable part of a lameness evaluation, but are not the end all be all for if a horse is lame kind of lifelong or what's going on. So we'll hold the limb, like the fetlock, we'll hold it kind of to the natural range of motion to the extent of flexion for 30 seconds and then have them jog off. And so we do the flexion exam, see, okay, is there an area that they were more sore to? And then depending on the horse, depending on which limb is affected, we'll then do diagnostic nerve blocks where we will kind of systematically work our way up the leg to numb certain areas. So we'll numb the heel to say, okay, is the horse sound now if we make the heel numb? If so, then we start looking at something going wrong in the heel. So that's just what we have to do because horses can't say like, oh, my left fetlock hurts. We have to go through those steps to do that. And then once we've located an area with the watching them go and the flexions, then we can do diagnostic imaging such as x-ray and ultrasound, and we do have, as I said, a portable battery operated x-ray system where the images pop up right there on the farm. It's great. And then a really nice ultrasound as well. So we can, once we isolate the area, we can start looking for abnormalities there. Let's see. The gelding is just off in his right hind. I see Brandy's question and doesn't like to stretch out his right front or even lift it for an extended period. Yeah, it sounds like he might be a bit stiff. So lameness exams can be anything from more severe issues to just like, my older horse just isn't quite doing as well as I want him to do. And we don't have to jump to multiple $100 treatments for every one. A lot of it is honestly just discussing, okay, let's find some nice anti-inflammatory supplements like MSM or Adequan. I love Adequan. We use a lot of Adequan. And then maybe changing the shoeing a little bit, putting this type of shoe on instead of that type of shoe. So lameness exams can be as involved and expensive as you want them to be, but I work with horses from all ranges, from upper level FEI, imported warm blood hunter jumpers to casual backyard, I go on a trail ride every few days type horses, and I treat them all the same, and we can usually make a plan to fit pretty much anyone and anyone's budget. Let's see. I think there's another question. Do you only treat horses? Yes. So as I said, we only treat horses. The Carrollton Animal Hospital is our sister company, so if you have a cat or dog at Carrollton Animal Hospital, you will still be in, we use the same record system, so we will have an account for you, and all the payment information and client information is already there. But as Carrollton Equine, we only treat horses. We don't treat goats, sheep, llamas, cows. You don't want me looking at your cows. I'm not very good at cows. So let's see. How many times a year should my horse see a vet? We in general recommend once yearly exams. Spring vaccines are a good time to get that, just so we can pick up some more subtle issues, like if there's like a slight heart murmur, then we can, that maybe wasn't there before, we can kind of isolate it and keep an eye on it. So a general once a year is a good place to start. Sometimes if they have significant issues, if they have chronic issues, we might increase that to a more frequent monitoring. But just having us at least lay eyes, lay hands, quick exam once a year, just so we kind of start to know that horse is normal. Like if we come one day and the left fetlock is a little bit thicker than usual, is that horse is normal? Is it usually that thick, or is that something new that we need to be concerned about? So it just helps us develop a better relationship with you and your horse, because I love having relationships where I just know the horse, I know what they're about, I can follow them on Facebook, I can see them go to shows, I can get updates from the owner. So being able to come out on a routine basis and not just seeing people on emergencies is what really helps us develop that relationship. And then it also helps us provide better care, where if I'm like at a conference and I hear of a new interesting supplement that's supposed to help navicular disease, I might say, oh, I know so-and-so has a horse with that, and I'll call them and be like, hey, you should try this. So I think it really helps to foster a really strong relationship, which is only going to help the care that we can give you guys. Let's see, do I need to call to get a price on hauling in for a lameness exam? So yeah, if you call that equine reception number, then they can give you quotes for pretty much anything that you want. I don't do a lot of the billing side of things, so I don't want to tell you a wrong number. But how we usually break it down is if we go out to your farm, there is a farm call. If you come into our farm, to Shenanigan Stables, you don't get charged a farm call, so you save a little bit of money actually by coming in. And then there's the lameness exam portion, which covers the physical exam, watching them go, the gait evaluation, the flexions, and then if we have to do any further diagnostics on top of that, like a nerve block, or if we then take x-rays or do an ultrasound, those are additional prices for the diagnostics. But to just watch them go, take a feel of them, kind of talk to you about your goals and your history and help make a plan for you, that is all included in just the lameness exam. Let's see. If no one else has any questions on there, I just have a few more previously asked questions. Let's see, what do I do if my horse is sick? As I said, call us, schedule an exam. If you have vet specific questions, we can call you back. If you think it's an emergency, let them know, and then we can decide if you need an actual emergency exam or when we can fit you in. What diseases should I vaccinate my horse against? So this could almost be an entire talk in itself, so I'm just going to really touch on like one or two key points, and that is, number one, it depends. It depends on what your horse's lifestyle is, what your horse's activity is. Is it a backyard horse that's retired and not going to be going anywhere? Or is it a 3-year-old in training at a boarding farm that has 30 other horses and is hosting horse shows every weekend? So it really is dependent on what type of risks your horse is exposed to. In that same line, just because your horse doesn't travel doesn't mean that they don't need vaccines. That's a very common misconception. People believe that, oh, my horse just sits in the backyard, they're not going anywhere, they don't need vaccines. So it is true that there are certain vaccines that they wouldn't need. They wouldn't need the flu rhino, which is an upper respiratory contagious disease package, that if they're not exposed to other horses, they won't need that. They wouldn't need the strangles vaccine. But there are certain diseases that we can vaccinate against, like tetanus, rabies, the encephalitis, so triple E, WEE, those are mosquito-borne, and especially West Nile virus is starting to get, at least in New York, it was very, I don't want to say popular, but it was not uncommon at all in unvaccinated horses to get West Nile. And those are diseases that can be deadly, and the vaccines are incredibly effective against, and they're incredibly safe. They tolerate them very well, and it's very silly to kind of put your horse at that risk when there's a very simple and effective way to prevent it. The biggest thing, honestly, is tetanus. Horses are crazy susceptible to tetanus, and they're always going to be at risk for exposure to tetanus. If they cut their mouth and chew on a stone and you don't realize it, if they step on a bush in the field and get a little scratch on their leg, anything that breaks the skin and introduces soil or bacteria into the bloodstream can cause tetanus. And horses are one of the most susceptible animals that we have to tetanus, way more susceptible than humans are. So a horse that is not vaccinated against tetanus can easily get tetanus, which very much can be fatal, and you end up spending, if you are able to save the horse, because we have had some tetanus cases that we have saved, but you end up spending way more on the treatment than you would have actually spent on the vaccines. So it all depends on what type of horse you have, what type of lifestyle. Is it a breeding horse? Is it a show horse? Do they eat round bales? Is there a pond on the property? There's a lot of different things. As I said, vaccines itself could be its own talk, and I think maybe it will be its own talk of all the different ones out there. But the two takeaways are it's individual to each horse, and every horse needs vaccines even if they don't travel. And then if you talk to us, you can kind of make a plan that works best for your particular situation. Let's see, how often should I deworm my horse? So similar, could do a whole talk about deworming, but I'll just pick some very important little tidbits. One, similar to vaccines, all horses need to be dewormed. I really sympathize with owners because deworming recommendations have changed a lot in the last 10 to 15 years. So what I grew up learning for deworming versus what people were doing when I was first applying to vet school versus what people are doing now is very different. So as of right now, the current recommendations are what we call targeted deworming. So it used to be back in the day, honestly, it wasn't that long ago, and there are still some companies that will promote rotational deworming, where every horse on the farm gets dewormer product A every 6 months, dewormer product B the other 6 months. So like you'll get ivermectin, skip a month, praziquantel, skip a month, and that used to be how it was done, and we have now found that that actually really promotes resistance. So not every horse needs to be dewormed the same amount, and there are companies that are still promoting rotational deworming, and those companies happen to sell dewormer products, so of course it is within their best interest to have you deworm your horse as much as possible. But every horse doesn't need to be dewormed that much, and by treating every horse in the herd with the same stuff every single time more often than it needs to be, we're promoting resistance to the dewormers, similar to like bacteria and antibiotics, and eventually it'll get to the point where we don't have dewormers that work. And honestly, a lot of the dewormers that they are still promoting in their rotational deworming, a lot of them have so much resistance that they're not even useful anymore anyways because of programs like that. So what I like to do is what we call a targeted deworming, where you do a fecal exam to determine, okay, does my horse have low worms burden? We do a fecal egg count. Do they have low, medium, or high? And then based on that particular fecal egg count, we develop a more tailored plan to you. So, and it's always really interesting because you can have two horses that live in the same field, have the same lifestyle, eat the same diet, and they can have massively different fecal egg counts. And that's because we think that there's a lot of immune system based to resistance to worms. So just because Fluffy out in paddock A had a 0 fecal egg count, Brownie, who's still in paddock A as well, might have 1,500 eggs per gram. So it's really hard to like treat the herd as a whole in that aspect. So a fecal can be done at our practice. We have the fecal machine right at Carrollton Animal Hospital. It's not something you need to make an appointment for. It's something that you can just bring a fecal sample in and we can run it right there. The requirements are that we just get a better reading if it hasn't been dewormed in the last 12 weeks. Because if they were dewormed within the last 12 weeks, there's still some residual effect from that. So as long as they haven't been dewormed in the past 12 weeks, then we can run that fecal sample. You can just drop it off to the clinic anytime. Fresher is better. If you can't get it there right away, put it in a cooler with some ice. If it's kept cool, it's usually good for about 5 days or so. So if you can't rush it in, don't worry about it. So that's all I'm going to say about worming, besides every horse should also be dewormed. There was another misconception that if your horse had 0 eggs per gram, that they never needed to be dewormed because they were a low shedder and had no worms. And that actually led to a bunch of parasites that we haven't seen in years actually coming back and making a reappearance, because there's several parasites such as tapeworms, bots, encysted small strongyles that don't show up on a fecal. So the fecal egg count that we do is to get kind of a general broad spectrum idea of, okay, is your horse really susceptible to worms, or are they pretty resistant? And the ones that are, even the ones that are pretty resistant and are constantly zero, we still recommend deworming them at least once or twice a year. I prefer twice a year, but honestly, I'll take once a year in the spring and after a hard frost, because that's going to get our bot eggs that live in the stomach, and our bot larvae that live in the stomach, and our encysted small strongyles, which are living in the wall of the intestine. They don't live in the intestine lumen. And so similar to vaccines, just because your horse doesn't travel anywhere, just because it has a closed herd and it doesn't get exposed to a bunch of other horses, doesn't mean that it doesn't need to get dewormed. So that, again, as I said, could, along with vaccines, could be an entire talk of its own, but those are the key takeaways. Another one. When should I have my horse's teeth floated? Again, dentistry, I could do a whole week's of talks on there. The very general rule is once a year. That's a very safe way to do it. Every once in a while, I'll come across a horse that I've worked on routinely, and every year they don't really have a lot going on, so I'll switch it to just an oral exam once a year and then float as needed. But by far, the vast majority of horses benefit from yearly dental exams and floating. There are some exceptions. Really young horses, horses under 6, I like to see them every 6 months because they're growing their teeth in, they're losing caps, a lot can change. Another misconception is that young horses don't need their teeth done. I like them to get their teeth done before they get a bit in their mouth so that we don't have any excuses for them to not like having stuff in their mouth. And honestly, young horses can be some of the sharpest with the worst ulcers that I've ever seen. So young horses need their teeth worked on, and if your horse has a problem in its mouth, if it has an overgrown tooth or a wave mouth or something like that, then we might do it more frequently, like every 3 to 4 months, to get on top of a problem, because a lot of these problems we have to address gradually and have to do it in kind of a staged procedure. But if you just stick with once a year, have that in your mind. It's really common for people to do spring vaccines and teeth. I'm comfortable doing both of those in one visit. So in one visit in the spring, they can just get everything done and you're hopefully set for the year. And then backing up a few steps just back to deworming, I forgot to mention all of my recommendations are for horses over a year old. So all of the doing the fecal, finding the fecal egg count, and then deworming at least twice a year. That's for adult horses. Young horses, especially under a year old, are susceptible to very different parasites, and they actually can have much more significant reactions to deworming if they have a high parasite load. So it is especially important in young horses to have a fecal done so you can figure out the safest deworming, because if you have a really high roundworm burden and you deworm with the wrong product, you can actually kill too many worms at once and it will cause an impaction colic, and it can be quite serious and need surgery. So especially with young horses, give us a call, drop off a fecal, and we are happy to make a tailored deworming. There is no one size fits all for every horse, every age, but I did want to mention that young horses are pretty much the only type of horses that you can actually do damage to if you deworm them inappropriately. Old horses are usually pretty resistant, and if you give them the wrong thing, they're usually very tolerant of it. But in our young horses, especially like our weanling age horses, if you deworm them inappropriately, you can cause some significant issues. And it goes back to the kind of quote of the day, just ask us, just give us a call. I'm happy to talk to people about deworming their horses. I'm happy to talk to people about individual vaccine plans. I obviously like to talk and like to tell people about stuff and like to discuss these things. So having a blanket statement for every horse should have XYZ just doesn't fit. So every horse is different. So if you ever have, like, even if it's, do I buy this brand of dewormer versus this brand of dewormer, like, just ask us, give us a call, and I'm happy to kind of help you with any of those concerns. Another question, what are wolf teeth? that I'm actually not going to go into because I will be doing a talk on dentistry at some point, and that's a very like specific dental question. And this is the last one, which I'll just touch on really briefly. Should I have an equine first aid kit? And what should go in one? So I am a big fan of people being prepared, and I hope you all have first aid kits in your tack room that you never have to use, but I would rather you have it and not need it than need it and not have it. So the very basics are, if you're going to buy nothing else, buy a thermometer, because there are so many times that people will call and they think they have an emergency or they have a sick horse. One of the first things I'm going to ask is, have you taken its temperature? So just having that one thing available is going to give me a wealth of information. So a horse that's acting a little quiet and off its feed with a normal temperature is going to be handled and scheduled very differently than a horse that's off its feed with a temperature of 103. So the very first thing would be a thermometer. They do make special equine thermometers, but we just use regular human digital thermometers. Get your horse used to having its temperature taken, because if it's never had it done before, they can be a little bit squirrely about it. So it's something I would practice doing, because if you are in an emergency situation and it's just you and the horse tied up or on the cross ties, you want them to be kind of comfortable with that procedure. So thermometer for sure. And then another few kind of essentials, kind of staples are, I like people to have vet wrap, or I think it's technically self-adhesive, cohesive bandage, whatever the term is. We all know it's vet wrap. Vet wrap, duct tape, can't go wrong with duct tape. Honestly, any sort of like bandaging that you would be doing in a true emergency situation is going to be something quick and clean with pressure. So let's say it's thinking more about something is bleeding, then having even just access to a clean towel, women's sanitary products like maxi pads will actually work pretty well. They're kind of just something clean to stick on it and wrap around tight until we can get there. Now these are not supposed to be, this is how we treat the wound, but that is how you're going to manage it until we can get there and properly evaluate it. So you can get really fancy with, have a headlamp and bandage scissors and white roll cotton gauze. You can go as fancy as you like, but for me, if you have a thermometer, a way to vet wrap, and like a pack of maxi pads, we can usually get you through most things until we can get there. And again, the biggest thing is just call us. Don't try to manage it yourself, and then give us a call when you can't manage it. We don't charge a phone consultation fee. And the nice part about that equine reception line is that it will, you can text it, so you can send pictures to it. So if you're like, my horse cut itself and it looks like this, that will help us decide, is this like we have to drop everything and run out there? Or is this we'll do it at the end of the day? Or is this, that doesn't even need sutures, we'll see you tomorrow for a regular appointment? So that is the last thing. I actually went a little bit longer than I was planning on, but it'll be a nice round hour. I have a few minutes if anyone else has any questions in the chat. Otherwise, if you're watching this on the pre-recorded because you couldn't get a chance to watch it on live, feel free to email its office at carrolltonequine.com any sort of questions that you maybe wanted to ask. We will hopefully be doing Facebook Lives once a month with different topics of the month, so feel free to keep an eye on that. And if you have a particular topic that you're interested in, that you have specific questions about, but you don't think you can make it to the live, again, just let us know, and I will have a list of questions that I'll answer that you can watch later. So that is everything that I was going to talk about today. So if no one else has any questions, which it doesn't look like anyone does, then I will bid you all a good night, and thank you for watching, and hopefully I get to meet a lot of you soon.